Hello, and welcome to Navigating Nursing. I am your host, Laura Whitehead, a registered adult nurse, a critical care nurse, qualified lecturer, and fellow of the Higher Education Academy. I'd like to welcome Katie Markham, who is an advanced nurse practitioner in pain management at Guy's and St Thomas's. Welcome, and thank you so much, Katie, for joining me today. I want to take you back first to when you qualified in 2012. You went to King's College London University. Why was that your choice?
Hi, Laura. There was a mixture of reasons, really. So originally I was debating going further afield to places like Portsmouth. I had a bit of a change of heart last minute on the course. I was originally going for radiography. So it was a bit of a change. Just felt that nursing gave you a bit more dynamic approach. There was more options to go into. So King's was one that's obviously quite high up on the rating scale. It's really recognised for its nursing college, and it's close to home. So it's somewhere that I really was keen to go to.
So you're a pain and advanced nurse practitioner. Was this an area that you always wanted to go into?
Um, so it's not really something I was aware of, to be honest, when I first started nursing. So I was very keen when I first came out of my course to go into acute work, so sort of critical care areas, ward areas, just to get a bit of a background experience in nursing and really establishing what I learned on the programme. It was only really during the time of being on sort of HDU areas that I got into contact with pain teams. So we were getting lots of patients with sort of epidurals, PCAs coming through to us. Obviously, pain following surgery was a big thing. So it was just more exposure to these kinds of patient groups that probably weren't being managed particularly well on some of the wards, and seeing the teams come up and give the specialist advice. So from there, it was really linking up with the team as their link nurse. So going to their meetings, going to their education days, bringing that knowledge back to the ward areas as well. That got me really interested in the field.
And that was how you kind of made that link, was by being the link nurse for the unit, and that then helped you establish those relationships. Because I know it can be quite hard
Definitely, yeah.
if you're looking at nurse specialist roles of how do you get in, how do you apply for a job. There's so many people that apply for certain jobs, aren't there? We kind of know when you look at NHS jobs what are the popular ones, and actually kind of getting your foot in the door. You did really well with using
Yeah,
that.
and I think it is getting to know the teams and knowing the areas of interest, because they're all quite competitive fields. And really now being the person that employs people into the deputy roles, it is really looking at people that have got a real interest in the field where they've done a bit of work around that. So we don't expect people to be experts when they first come into a specialism, but it's, have they got an interest? Have they done something towards that, like becoming link nurses? Have they had a bit of exposure? Have they done audits around sort of pain management in the areas? So it's really showing a real interest that people are willing to learn and expand on that. And most junior roles as CNSs tend to be quite rotational posts, so they get a bit of exposure to the area but aren't expected to make the final decision on a lot of the care needs.
And you've done a lot of roles within the pain management kind of area. So you've been the pain deputy CNS, a CNS, an AMP. You've worked in research and as a matron. What's been your favourite role that you've done?
Oh, it's really quite difficult to say. Probably not a particular role. It's the whole field, the fact that it lets you bring a lot of education into the piece and sort of change the way patients' pathways work. So I guess the AMP role in a more senior role has allowed me to do a lot more things and have a lot more knowledge behind the specialism. So as an AMP, I've sort of had a bit of matron responsibility for our directorate, which is medical specialties. So I get involved a lot in the audit behind that and the safety of the different areas, and looking at outpatients settings for patients coming into them. But it also has let me do a bit of research as well. So I get a bit of time to do research based on the specialism. So a lot of the work we do in research is sort of groundbreaking. We're one of the biggest centres in the UK and the world, actually. So we get to see things firsthand and really incorporate that into the work we do. So I guess, although all of the roles have been slightly different and all been brilliant, the AMP role's probably been the most flexible and the one that has allowed me to do the most.
And you've recently been redeployed to the Nightingale Hospital at the Excel, which has looked after patients with coronavirus during the first peak of the pandemic back in March. How did you find that redeployment process?
So to be honest, I was one having to lead on it at the time. So
Oh,
we
wow.
kind of day by day got information about who needed to go where. So obviously it came in quite thick and fast. We didn't quite know how it was adapting. So really sort of outpatient settings were the ones that were closing down to a degree quicker to try and support the acute units. So it was really looking at safety and risk from our level of what we could release, redeploy in terms of staffing to the areas to support them, but also make sure our areas were kept safe. So that process was kind of from a management background of making sure people were going to the right areas, we had enough to cover what we needed, but actually going to the unit ourselves over at Nightingale was pretty daunting, to be honest. Like a first day there, like a massive hangar, you walk in and it's just bed after
I
bed
remember
after
seeing the
bed.
pictures
So I
on the
think,
Daily Mail and I was like, wow, it's just, you couldn't
yeah, so
even
I think
comprehend it.
definitely, I think it was just pure scale, because we didn't obviously know at the time what quite was going to take off with the Nightingale or COVID. So it was kind of, it was quite daunting to go back in there, and even with sort of critical care background, having to go back in an area which I haven't done that sort of hands-on on a ward clinical work for about 5 years. So going from doing something that's quite office-based, quite like I said, research-based and management-based, to going back to being really hands-on with beeping machines and pumps and things, was really, really daunting. But actually, it's kind of like a muscle memory, and it came back really quickly. So just getting involved and being able to use some of the management skills as well, because there were a lot of junior staff that were being sent there that really had no exposure to ITU. So it was just supporting those teams, working together to try and make sure everyone was trained up to a degree, everything was safe. So it was quite the experience, and although a horrible time, it was actually quite a nice experience to go back to and to get back hands on again.
I bet, because me and Katie first met, poor Katie was my co-mentor when I was a student, back on the cardiovascular high dependency unit at St Thomas's. So you started in the HDU as a newly qualified. How did you find going to that critical care area? Because I know at the time you were one of the first people that they'd ever taken as newly qualified. It's become a lot more common, I think, since then, of newly qualifieds going into kind of level 2 and 3 clinical areas. But how did you find that experience when you qualified?
I mean, having you as a student, as my first student, was probably the easiest ride, because you
Obviously
were
the
very,
best
very good.
experience you've ever had.
It's just been nothing to match up to, really. But no, it was, I mean, it was daunting going in as a newly qualified nurse straight into a critical care area, but I had the benefit of doing a 3-month placement towards the end. So it was really my final placement. The management placement really bedded me into the team. So I knew the team well. Sort of our ward manager was really supportive with that, and training needs. So that helped a lot, I think. But it is a daunting area, and I think it was a time when that rarely happened. Most people couldn't go straight into a critical care area at the time. I think now they've appreciated that it is something to do as part of a rotation. So I think quite often now it is looking at sort of HDU ward areas and ITU based areas at once to get you a full exposure. But it definitely throws you in the deep end, but gets you up to skill really, really quickly. So
Really
whilst
fast.
daunting, it was a great experience just to get stuck in. And I think it puts you, for these other roles, it does put you in a better position where you've kind of dealt with these situations where the patients are quite complex. So going into specialist roles, it really shows that you've got a bit of diversity in what you can and can't manage. So it definitely helped, I think, going from there on to a specialist role in the future.
So you've done a lot of courses. I asked Katie to send me a list, and it was probably too much for an A4 sheet of paper. So you had your advanced diploma that you came out with when you qualified, and you've then topped that up to a degree. So congratulations.
Thank you.
How did you find that top up process? Because I know quite a lot of nurses now are looking at, obviously, nursing being a degree profession from being a pre-registered nurse, of doing that top up if they've done a diploma or advanced diploma in the past. How have you found that process?
Yeah, I mean, to be honest, looking back now, I would love to have done it back when I was doing the program from a time perspective, because obviously doing it alongside work can be quite tricky. But it has, in a nice way, allowed me to mould the courses I've taken since. So it's really allowed me to focus. So some of the modules I've done are things like advanced assessment skills, which I use day in, day out with assessing patients. I've been able to do a research-based module and a pain management module. So it's really worked for me in that it's really honed my skills around the specialism I've gone into. It's just a slightly longer process doing it after, but actually it's still quite the achievement afterwards when you get to that point. And I would really recommend it to anybody, because the profession is kind of moving towards a more academic look, I think. And whilst experience is key, and there's a lot of people that I work with that are really expert people that don't have degrees and masters and things, it really puts you at a different level in terms of sort of your academic ability and how you look at evidence-based practice and particularly research papers. It really helps with all of that. So it's a slow process sometimes, but definitely worth it in the long term. And I don't think there's any harm doing it after, because it does let you mold it to your
To your
needs a bit more.
career.
Yeah,
And the critical analysis, something that as a lecturer, we talk about it all the time, and I think we do it automatically in practice. That's part of your everyday decision making process, isn't it? And I found doing courses post qualification actually a lot easier than my when I was doing my
definitely.
undergrad.
I think
um
you can definitely bring things in, like just doing the dissertation was really helpful because I
mm,
molded it very much around setting up an education package for our team. So
mm,
it was really sort of to the heart. It was something we needed and wanted to change within our service. And it allowed me to have the knowledge and be able to read from the different places like British Pain Society and RCN that we work very closely with, and incorporate that, but also assess what was and wasn't very helpful to add to that. So I think that's a skill that definitely, as you develop as a nurse academically or in practice, you just learn that as you go along and know
mm.
what is helpful and where to find information, where to source it. Using your team members is great as well, different professionals. So yeah, it definitely helps in the long term.
And one of your courses you did was a good clinical practice, looking from a research perspective. I hadn't actually heard of that course before. Do you mind just explaining a little bit about that?
Yeah, so it's normally trust run, but most people that undertake any kind of research role need to complete it. So it's basically looking at how we do research projects. So it's looking at things like quantitative and qualitative studies. It looks at sort of the ethics behind doing research and the numbers we're looking at. So it just gives you a good basis to, when you're working on a research project, when you're setting one up, what kind of things you need to consider, how we make sure we're doing it correctly and we're getting the right data, what we're hoping to collect from it. So it's kind of an overview. It's something you have to sort of re-establish every couple of years, just to say you're up to date with it. But normally you're not approved to be on studies unless you've done that course. But it usually tends to be in-house with your trust and research teams. So
And we've kind of covered a little bit of this already. Have you got any further advice for any nurses that want to move into your field of practice?
I mean, common sense. It's a difficult place to work. We have a lot of patients in pain that are really quite complex patients. So it really involves working with an MDT, thinking about people with long-term chronic conditions. It comes alongside a lot of issues like mental health problems and behavioural issues, which can be really troublesome to manage, and why we really rely on a heavy MDT in psychology and physio support, occupational therapy. So I think pain, if that is something you're interested in, being a link nurse would definitely get you towards that field, get a bit more knowledge behind it, potentially think about areas where you are going to see a bit more of the team, and things like PCAs and epidurals, so surgical units or critical care areas are probably good places to go. But really just get an interest for the field, and providing you have that when you go for interviews, that I would say the key recently doing lots of interviews is making sure you visit the area, really know what it's about, what we have to offer, before going to that interview, because that really puts you in good stead to get through the process, really.
And I think the informal visits are something that it really gives you a lot of information, doesn't it? I know I've gone on informal visits for interviews and gone, actually, I wouldn't want to work here. Or I've gone, I love it. I really liked the people. They were really friendly. And yeah, you're right. It does give you an insight, doesn't it, into the
100%. And
role.
it, like you say, it lets you know whether it's an area you think you are interested in. And actually, quite often job specs don't give you huge details about what to expect, really. It's just kind of a very broad overview of this is the service. So we get a lot of people, obviously we're a big service. We have an acute inpatient team and an outpatient chronic team, and people aren't always sure which one they're applying to. So, if you're only interested in one particular area, or you want to work more inpatient based or outpatient, it's worth knowing that and speaking to the team. But also for interview purposes, that a question you will always get asked is, what do you know about our service and why do you want to work here? And that is common for every single interview I've ever done. Why do you want to work with us? So if you can, say, oh, well, I came to visit you, I've learned this about your service, I kind of know what things you offer, what clinics you offer, which programs you offer, you're going to be in a lot better stead than somebody that comes in, which often happens, going, oh, well, I assume you deliver some sort of pain clinic. It shows your
Yeah.
interest, and it lets you answer those questions a bit better, and gets you out that nervous phase at the very beginning when we ask a question that you're like, actually, I do know the answer to this one.
Yeah.
And
I've
it
got
puts
one
you in a
ticked off.
better position. Yeah, I know this one, let's go. It really helps.
So have you got any advice for anyone that wants to be an advanced nurse practitioner?
So advanced nurse practitioners are really still quite new in the field, I guess, and it
And Guidance
really
St
varies.
Thomas's have really led, haven't they,
They've
on
really led on that. And I think King's as well, they're looking at developing programs. I know a lot of the other universities, obviously Middlesex, I assume, do their own version of this, put in their name as well. But it's, I think, yeah, it's looking at the area, because there are general AMP sort of competencies and things outlined by the RCN, so they're a good thing to look at. But it is going to be very different depending on areas. So what I provide as an AMP in pain will look very, very different to somebody doing that in a GP practice or an A&E department. Obviously my expertise is around pain, so I'm not going to be assessing people for lots of weird and wonderful conditions, for infections and other things, whereas somebody in A&E or a GP practice might be. So it's honing again the skills to it. They're there as a guide. So it is looking at things like, from an academic perspective, are you somebody working towards a master's or a PhD in the future? Do you have a field of interest? Are you thinking about doing things like prescribing courses? Is that something that can be done in that area? And I think they're all things that really open it up for nurses. It makes them really autonomous, and quite often we work very closely with consultants or GPs, but you do have your own level of practice without relying on other members of the team. You are somebody to go to for advice and expertise for junior members of the team as well.
And Katie gave me a lot of advice when I was newly qualified, and when I was having the panic, I'm in my 12-week placement and then I'm in a blue uniform on my own moment. Have you got any one particular kind of bit of advice for student nurses or newly qualified?
I would 100% say that work is obviously very, very important, and we always talk about doing reflection and debriefing, which I must admit is something back when I was in university wasn't something that particularly interested me, but being a nurse and being out there having day-to-day bad activities going on, good days, bad days, it really helps to be part of that team and to debrief and really think about how you can improve your practice. Everyone's going to have a bad day when they first qualify. It's just inevitable, unfortunately, but it's how are we going to make this better? How are we going to work as a team to make sure this doesn't happen again? And tomorrow I come back and have a better day. And it sounds cheesy, but go home, have a sleep. The next day is always that bit better. But I think also having something outside of work is so important. So, if you've got something that you can unwind with when you get back home, whether that be an activity, a person, having a conversation, having a cup of tea, whatever you do, just getting away from work, because you can't make it your whole life. And I think you can get
now, obviously with COVID and all of what we're allowed to do is so restricted, but I did quite a lot of rowing when I first qualified, and I really liked the fact that on my weekends off, that was then what I did. That was something that you kind of use your brain for, rather than
it's something that makes you and not just Laura the nurse or Katie the nurse. It's something outside of work. So when you do have those bad days, you think, okay, well, I've got somewhere to go, which is so tricky in COVID, and I think that's why a lot of people are struggling right now, because you go home and it's COVID on the telly and it's COVID not going out. So it's just trying to find your niche of what's important for you, what you can go home to, that's not going to wrap you up in work so much, and that makes you a better nurse, I think, in the long term, because it lets you relax from it
and helps you build some resilience as well. I think it can be
100%.
so overwhelming, can't it, especially when you first start. I remember giving paracetamol for the first time and being in a complete stress that I was then administering this, and then you look back and you think, what was I stressed about? It was 2 paracetamol, it was fine.
Exactly.
But at the time, what you worry
the fact
about,
that you're now responsible, and it does make you jump out your chair, I think, when you first have to do it. But I think it's relying on your team and knowing that you've got the knowledge, you've been doing it, particularly in your last placements, you've been doing it pretty much independently, just with a bit of supervision for a long time. So you're in that position already to do it. It's just getting the confidence and getting used to doing it.
And last question, where do you see your career going? I know you've got a very exciting kind of new job lined up, and what are your aims for the future?
So it's a bit of a change. So Laura will know that I've always had a bit of a hankering for old people and care homes and things like that. So I really always wanted to get a basis in acute care, specialised in an area, sort of progress from a management perspective. And so I'm actually in the next sort of month or so, I'm leaving pain management for a while to go over and set up a new care village in Battersea in London. So it's really going to be from the ground
Amazing.
up, employing staff from the clinical side of things, setting up all the policies, procedures, dealing with CQC. So it's care based rather than nursing at the moment, but they're really keen as a company to develop into nursing care. So we're looking at things like the nursing associate programs,
Mm,
developing into nursing and things like that. So it is a bit of a shift. It's
mm,
more along the management route, but hopefully in the future, if I ever think of, which I potentially would do, go back to sort of A&P work, it would put me
mm.
instead that I've had a management background, I've set up a service, I've changed a service, and that would only really improve my ability to do
Of
the A&P role
course.
in the future. So I
I
mean,
like how you
it's
say
I
that
think
so
it's
casually. I've set up a service.
set it up, yeah, done it from ground up. But I think it's important to think that it's not always a fixed outcome. So you kind of feel like you're
Mm,
leaving the NHS doing something different. Is that going to be it now? But there's no reason why you can't move back into roles, change
mm,
roles, use skills you've got from other places and sort of adapt that into the role that you ultimately want to be in. So I think, again, not being too fixed to one area forever is a good thing
mm.
as well, getting
And I think as
skills
well,
from
I
different
think the
areas.
NHS and different companies have become so much more flexible. I think it used to be
100%.
you go in that role, you're there for 15, 20 years, and then you might move on, where that isn't necessarily how roles are anymore, are they?
No, and I think there's so many diverse roles in nursing that it's not always just nursing. It can be
Mm,
research, it can be management, it can be, I mean, we've got a research nurse now leaving to go off and do an auditing role. So
mm,
just because you've trained as a nurse and worked as a nurse, I think it's important to think that you've always got that and that's something you can always come back to. But
mm,
do you want to try something different? And those skills you get from other areas are always going to be beneficial coming back into nursing again. So really sort of explore with what you've got. Nursing is just
mm.
a great avenue to get into many, many different roles.
Yeah, it's true. Yeah, and
So yeah,
congratulations. Thank you
thank
so
you.
much for chatting with me today, Katie, and good luck with your
No
new role.
problem.
And when you're
Thank
all
you.
established, I'd love to interview you again. I'm just going to sneak that
Oh,
in there,
please do.
just to
Yeah.
hear all about your new role and how it's all gone. But thank
Yeah.
you so much.
No problem at all. Thank you very much.